the overarching umbrella between this going into the pharmaceutical industry and the FDA was a desire to know, well, how does industry investigate the problems with the drugs, and how do they communicate that to physicians to look after patients? And then how does FDA regulate, and how does FDA watch the pharmaceutical industry and keep them accountable? Because those were things that I couldn't really make sense of at the time in residency, because you see something happening and you're just like, this is wrong what we're doing. And then it's like, how could this be possible? And so I'm just like, well, I guess I'm going to go there and see what's happening on the inside of these places. And that took me there.
I love it. And so what did you find?
Yeah. What I found was just like, I think there's this book by about one of these old these war criminals from Nazi Germany, and it's called The Banality of Evil, where they talk about just how terrible things can happen in just like the most simple and uninteresting ways. And that's really what, unfortunately, I saw in these places, because everyone knows someone in the pharmaceutical industry in the US, probably a cousin or a sister or a brother. I mean, it's a big part of GDP. People work there. So these people aren't evil. But when I was in there, there are so many it's just a tremendous amount of pressure to interpret things in a way that's favorable to the company. I mean, at the end of the day, things are, they're there to make money. And so when I was in the pharmaceutical industry, I was a drug safety physician. And so I'd be looking into all of the side effects, and we'd have to write reports on what was happening. And we'd say, this is really important. Physicians are going to want to know this stuff. And we would just have like the chief medical officer come in and just say, well, I think we're going to get people too worried if we publish a paper about this. So, we're not going to do that. So that there are all of these pressures to only talk about the benefits of the drug and minimize the harms. So that was one thing that I saw in industry.